Your nurse today. How are you feeling?
Good.
You feeling better than when you came in?
Yep.
Good. Okay, so we're gonna get you discharged today, and I have some instructions from your doctor, and we're gonna go over some medications that we're gonna send you home with, and then I have some packets that you can read over before you go, and to take home with you if you need any more information. But so the first thing that I am going to talk to you about is we are sending you home on 2 liters of oxygen, which is new for you, and you will have a portable oxygen tank to take around with you. But it says here that you do have a history of smoking. Is that true?
Mm-hmm.
And are you currently smoking?
Mm-hmm.
Okay, so oxygen and smoking do not mix. It's actually super dangerous, and you could cause a fire. You could actually, your tank could explode. And so I would really encourage you to not smoke around your oxygen tank. And even if it helps, like, have your husband like keep you accountable to that, just because that is really dangerous, not just for your health but for the people around you. So that's really important to remember. But yeah, so now I'm going to tell you a little bit about your medications. We're sending you home with 9 medications to take, which is a lot, but I'm going to explain them to you. If you have any questions, you can stop me and ask me. So the first one is metoprolol, which is what we call beta blocker, which is to help you kind of control your blood pressure and to help your heart work a little bit better. You're going to take that in the form of a pill, and you're going to take it twice a day. Furosemide, you have some like fluid in your legs because your heart's not working as well, and so we're going to help you get rid of the fluid by taking the furosemide. It's a diuretic, and it's going to help you pee out all the extra fluid. You're also on potassium, which is literally just to increase your potassium levels. You're going to take that in the form of a pill twice a day, or no, once a day. And that should also help your heart work a little bit better as well. You're on warfarin, which is a blood thinner. You're going to take that in a pill. You're going to take it every day. And then you're on gabapentin for your, you know how like your hands and your feet can't feel as well because of your diabetes. We've talked about that. So that's going to help you with that and with the nerve pain that you've been feeling. You're on aspirin, which is a blood thinner as well. And that's good. You're going to take that daily. You're on docusate sodium, which is a laxative. It says here that you had a bowel movement today, but it was a small amount, and so we want to help you have some more regular bowel movements, and that'll help you when you go home. You're on hydrocodone for any pain that you might be experiencing after your bypass surgery. And it's an as-needed medication. You're going to take 1 to 2 tablets every 4 hours if you're having some pain. And then Januvia, which is for your diabetes, and this is going to help you control the sugar amount that's in your blood. And so it's a really confusing schedule, so if you need help with that, we can send you home with a pill organizer, and you can ask your husband to help you organize the pills so that you remember which ones to take and when, if that's helpful. Okay, and so then your doctor has some orders specifically for your discharge. You are going home with your husband, correct?
Mm-hmm.
And what kind of a house do you live in?
Like a 1-story ranch.
Okay. Do you have any stairs or anything to get into your house? Good.
Mm-hmm.
If you have around your house like a lot of carpets or a lot of like electric cords or anything like that, you're going to want to either get rid of those or move those out of the way, just because we don't want you to be tripping and falling, especially right after your surgery. So that's just like a safety measure that you can use around your house. So you have a couple different incision sites that we want you to be really good about taking care of. So you have one here, and then you have one on your hip as well. And so you want to make sure that you are keeping those clean, and you can do that with water and soap daily. It doesn't have to be anything we don't have any specific soap for you, but when you're doing it, make sure that you're like dabbing it and drying it well. Don't like rub it or anything like that, and look for signs of infection. Whenever you can, leave it open to air. And if there are any infection signs, make sure you call us. Let us know if there's any redness or draining, a lot of draining from either of the incision sites, or if it's rapidly changing in a really odd way. And if you have any sort of like a fever suddenly, make sure you call us because we want to know that. He has a specific diet for you chosen. We're sending you home on what's called a heart healthy diet, and obviously you're going to continue your diabetic diet from when you came into the hospital. Big things are to avoid any canned or high sodium foods. So just don't eat any canned vegetables or anything like that. Eat lots of fresh fruits and veggies. You can have beans that aren't canned, whole grains, fish, nuts, and green yogurt. Another thing with your warfarin, the blood thinner that we talked about, is that vitamin K is, it kind of works against that medication, and vitamin K is found a lot in leafy greens. So make sure you're not eating too much of that, otherwise your warfarin won't work. Since you did just have this surgery, you want to make sure not to lift anything over 10 pounds for the next 4 to 6 weeks. So if you need any help, make sure you talk to your husband about lifting heavy things for a while. We're also going to need you to do a follow-up appointment in about 2 weeks. So if you need help setting that up, I can help you do that right now. We can get that set up for you if that works. Does that work? All right. Do you have any other questions for me? All right. Sounds good.